afternoon, everyone. Today, I would like to address a critical health issue that affects us all, gun violence. But first, before I get started, here's a little bit more about me. My name is Julia Weissman, and I'm a rising senior at the Beacon School in New York City. I'm very passionate about addressing pediatric mortality and public health crises and aspire to work in the field of pediatrics. I participated in science research and this summer researched low-intensity ultrasound as a possible treatment option for glioblastoma. I'm co-captain of the Beacon debate team and vice president of the Key Club, and outside of school, I'm an active volunteer for many local organizations. I also work with the Peer Health Exchange to better the mental health care field for over 400,000 youth nationwide. Now, on to the main topic of today's discussion. On June 25th, 2024, Dr. Vivek Murthy, the U.S. Surgeon General, declared gun violence a public health emergency. This declaration underscores the severity of the crisis that we face globally. Gun violence is a leading cause of death and injury worldwide. In 2023, an estimated 261,000 people died due to firearms, with about 60% of these deaths being homicides and 35% being suicide. In fact, gun violence has killed over 7 million people since 1990. The physical impact of gun violence is devastating. Victims who survive gunshot wounds often face lifelong disabilities, chronic pain, and extensive rehabilitation. According to the World Health Organization, gunshot injuries can result in severe physical trauma, including spinal cord injuries, limb amputations, and traumatic brain injuries. These injuries impact individuals and place a significant burden on healthcare systems worldwide. Globally, there are approximately 1 billion firearms in civilian hands. This alarming figure highlights the widespread accessibility of guns contributing to the escalating rates of violence. The physical toll is staggering, but the mental health impact is equally profound. Survivors often suffer from PTSD, anxiety, and depression, significantly affecting quality of life. The psychological effects of gun violence extend far beyond the immediate victims. Witnesses, first responders, and entire communities can experience long-term mental health challenges. Children in particular are vulnerable, with exposure to gun violence being linked to developmental issues and increased risk of future violence. According to a study by the American Psychological Association, that approximately 32% of children who witness a shooting will develop PTSD. Let's look at a global example, Brazil. In recent years, Brazil has seen an alarming increase in gun violence. In 2020, Brazil reported over 43,000 gun-related deaths, making it one of the countries with the highest rates of gun violence. Children and adolescents are disproportionately affected. In Rio de Janeiro, a study found that nearly 18% of school children had witnessed a shooting in their community. This exposure not only threatens their physical safety, but also their emotional and psychological well-being. Supporting the urgency of addressing gun violence as a public health issue, a comprehensive study published in The Lancet Public Health in 2018 found a strong correlation between stringent gun control laws and the lower rates of firearm deaths. The research highlighted that countries with stricter regulations, such as Japan and the UK, have significantly lower instances of gun-related homicides and suicides, compared to countries with more lenient laws like the United States and Brazil. So, what are some current solutions? Well, governments and organizations worldwide are taking action. Here are some specific measures being implemented. In technology and innovation, organizations are utilizing fingerprint recognition and other technologies to ensure that only authorized users can fire the weapon. Additionally, cities like New York and Chicago use systems that detect and locate shots in real time, allowing for quicker response times. In legislation and policy, there is Australia's gun buyback program, where following a mass shooting in 1996, Australia implemented strict gun control laws and a buyback program, resulting in a significant reduction in gun-related deaths. Additionally, several countries have adopted universal comprehensive background checks to prevent firearms from falling into the wrong hands. Organizations like Cure Violence work within communities to mediate conflicts before they turn into violence. Of course, there are school-based intervention programs aimed at educating young people about the risks associated with gun violence and promoting conflict resolution skills. Like many of you, I fear for my safety in school, at concerts, and in public spaces. From a young age, I've been affected by gun violence. In fifth grade, I participated in protests and even led a walkout in my elementary school in response to the Marjorie Stoneman Douglas shooting. I also had the opportunity to speak at the New York City-wide Principals Conference about this pressing issue. And just last week, I received a New York Times honorable mention for my essay about Dr. Vivek Murthy's declaration of gun violence as a public health emergency. Currently, I'm working with Peer Health Exchange to create a violence resource page on SelfC. The SelfC platform provides resources to support youth mental health, both virtual and local. By offering support and information with this resource page, we hope to empower young people to cope with and overcome the trauma associated with gun violence. It is crucial to emphasize that gun violence is not a political issue. It is a matter of public health and safety. This is about protecting the lives of civilians, children, families, and communities who deserve to live without the constant threat of gun violence. Here are some of the acknowledgements for today's presentation. In conclusion, gun violence is a global public health crisis that demands our immediate attention and action. It affects not only physical health, but also mental well-being, with children and communities bearing a significant burden. However, by implementing innovative solutions, effective policies, and community-based programs, we can make strides towards reducing this violence. Now, before I end, I want to leave you with this. By framing gun violence as a public health issue, we can strip away the divisive politics and focus on what truly matters, creating a world where children no longer flinch at loud noises, where the first day of school is filled with excitement, not fear. This isn't just a campaign, it's a call to build a future where every child feels safe to learn, to grow, and to dream without the shadow of gun violence darkening their path. If you or someone you know has been affected by gun violence, I encourage you to seek support and resources. You can contact organizations such as Every Town for Gun Safety or the National Suicide Prevention Hotline at 1-800-273-TALK. Before I end this presentation, I would like to thank the Johns Hopkins Global Health Leaders Conference for providing me a platform to speak about something that I feel so passionate about. And I would also like to thank you for taking the time to listen to my presentation, and I hope that you learned something valuable. Together, we can advocate for change, support survivors, and work towards creating a safer world for everyone. Thank you.